Welcome to Acton in Focus. I'm Vivian Kopsinger-Birchall, your host, and my special guest is the Director of Health of the Health Department with the town of Acton, Penelope Funaiole. Welcome again to Acton in Focus.
Thank you.
It's been almost a year since you were here. You had, just come almost to the town, and a lot has happened. We see all the updates on social media. You're doing a fantastic job.
Thank you.
But the purpose of this, interview is first of all to learn about, very briefly, how would you summarize what the past year has been in terms of the changes the changes within the health departments in the town of Acton, just very briefly.
So in the last year, I think the most significant asset that we've gained is that our public health nurse is on board now. We have had public health nurse service coverage through our Acton nursing service, but now we have a full-time nurse. She does give a third of her time to the town of Littleton, but she's in the office all through the week, able to attend statewide meetings, able to participate in regional meetings and meetings with the hospital and Emerson and things like that. So her attention to everything has been tremendous. She's already started a lot of different activities too, so that's really great. In addition to that, though, we've done a great job of working with our regional public health coalition, Northwest Public Health Coalition. We have a grant that we share. Westford is the lead, and we've done a lot of work with those two employees to really bring the health department up to speed, get a lot of proactive messaging out. We've had a really a good year, especially with communications. I think we've done a good job of showing what the health department does to the public.
I'm just curious, on average, how many requests, for example, do you get from the community a month or even a day, just to give us some point of reference to help in terms of public health needs and emergencies?
So because I'm the Health and Human Services Director, there's a couple different buckets that I would be thinking of, right? Okay. So number one, our health inspections. We have standard health inspections we have to do. What we typically get, though, is we get housing complaints. So those kinds of calls will come in, and it can happen that, over a long weekend, we get 3 housing complaints or 3 housing issues that have been identified, and then it might go for a month that we don't get something. But typically it's about every 2 weeks, we probably are running 2 to 3 housing cases. So that's where the health department sort of unexpected work will come in. And then on our other side of the house, which is the human service side, we have Beverly Hutchins, who is our 60 plus social service coordinator. She's actually the assistant director of the Council on Aging as well. She is busy every day. All day, fully packed, needs, all kinds of needs for folks. And then Laura Ducharme, she runs the Community Resources Department, and she serves 60 and under, and she's also very busy. She's also splitting her time to run transportation, which is another factor that we are out there helping the community, getting people to their medical appointments, to the grocery stores, and places they need to go. So I'd say, like, within those spaces, that's sort of the flow of work. But the other person that I can't leave out is our veterans officer. He does incredible work. He goes above and beyond. He's mandated to support veterans who are financially constrained, but he always is supporting any veteran that comes to his door with other ways that the VA services can be applied to these people's conditions. So they're always having meetings and cases going on. We are very, very busy.
Right, which brings me to another related question. Given you've worked in other towns as well, and you live in another town, what are some of the similarities that you've seen with other boards of health? And most importantly, what are some of the ways that Acton stands out?
Oh my goodness. Acton has a system of care. Okay. Most communities do not have this system of care that Acton has set up for their community. The 60 plus community, they come into our senior center and they have access to a medical professional right there and then. Okay. That's not, that said, most Council on Aging have a nurse, but our nursing service is doing a lot more medical care than public health nursing. Public health nursing is typically like disease tracking. It's more of that and some blood pressures, but where they're doing wound care, so they can say, "Ooh, you need to go get some help." So I see that as just like one of the most significant differences in other communities. And then also the transportation. The transportation is generally run by much larger but Acton has owned it, and we are working constantly to make sure that our transportation is meeting the needs of our community. And I think that since Health and Human Services has taken on transportation, we're getting closer to that than even before.
Right.
So we're still open to, though, like just continuing to grow transportation no matter what it looks like. But we're able to really provide direct services, get people to where they got to go, which is very helpful, rather than trying to find someone on a phone, where
Right.
my social worker in another community would have had to find those resources and spend time tasking those resources. So I think Acton's doing real good. I'm very proud to be here.
Right. And, we'll come back, we'll bring you back to the studio just to talk about the transportation component, which we will not be able to do today. But again, just to follow up with some of what you said, what have been, it's a twofold question. What are some of the challenges that your department has experienced, and what is your vision for this year in terms of addressing some of those challenges, and even, just any other additional parts of the vision?
So I think the most important thing, if you're a practitioner of public health, you need to be data driven. We need to make sure that all of our data collection systems are running, that they're capturing the information that we need to describe both the problem and the solution. And then finally, with that also, if we're properly tracking our information, we're also then able to ask for funding, right? We can tell our story clearer if we're doing that. So we're doing that in a lot of different ways with our inspection team. We're looking at better ways to track all of our violations, and how we can do better education approaches in real time. We want to make sure that we're understanding the workload in the health department, because it is mandatory statutory requirements that we do these inspections, and if we aren't meeting that, then we're not meeting our responsibilities. So that's a huge one. One of the missing components of health departments that I'm aware of is that a good tracking system for your housing cases.
Right.
And that is as I said, those are the ones that come unexpected. We don't plan for those. So if I can start to track not only the time that we're spending on them, but also the ways in which we're helping to solve them and resolve them, because I do want to point out that a housing case is not just going in a code violation. Sometimes it's a social service need that needs to happen first. We need to help people before we put them into a position where they could be homeless, right? So that is the priority, is helping. So I need to also track that, track my social service outreach that has to go along with that, track how long it takes to resolve the issues on the cases. So that's one of those spaces. In our nursing service, right, as I said, we have a VNA. That is very rare. And so because that, we have multiple nurses who have been covering public health for a long time. Now we want to stop and say, okay, let's deeply track what we've been doing. Because we know what we're doing in our nursing service. We have to know. We're billing insurances, we're paying, right? That stuff has to happen. So, but on this other side, how many blood pressures do we do? How many podiatry clinics do we do? How much of an impact are we making on overall wellness for our residents based on some of these practices that we've already been doing, but now I just want to show in a real way what that looks like for folks. So I think that data collection, data driven, is really important. One of the things I want to make sure that is a whole community approach is public health emergency preparedness. So we have an emergency management director who knows serious things, right? She's the chief of fire. But public health has responsibility with emergency preparedness as well, making sure that everybody is ready for when this does happen. So no, we're not going to be at command when there's an emergency, but we want to make sure we're ready to roll. Right. So that'll continue to be our part, and you'll start to see some information about the Medical Reserve Corps and how you can get involved and be a part of our Medical Reserve Corps. And the more volunteers we have, the better we are when the time comes. But also it could be just as simple as like a very happy event. Maybe it's a well event that we want to draw in residents to participate. Maybe it is some sort of, medical thing or a vaccine clinic that we would then reach out to our Medical Reserve Corps for that. So that's exciting. And then of course I'm going to stop there because I know you had a second part to that question.
Always, I have second and third parts. But anyway, just one of the things I wanted to follow up on is the data part. Many people in public health, use that narrative a lot. We need data. We are working on data-driven, solutions. But not often do they talk about the challenges of collecting data and the accuracy of the data. And we live in, Acton has about 26,000, residents. What are some of the gaps in collecting that data? That's in terms of the demographics, and also in terms of the quality of the data. What has been your experience? What are some of the gaps? And as you think of, the next steps this year, what are some of the ways that you're trying to address them?
So, I mean, I think that when we talk about data collection, you have primary and secondary sources. So do you collect the data, or are you using data that's already been collected, right? So a lot of the work that we do for our needs assessment does come from secondary sources of data, right? Hospital data, statewide data, all of that stuff. And that data has been cleaned and thoroughly vetted, right? I believe I can trust that data. The primary sources of data, though, it's important that when we do it, we're thoughtful about what we're asking, but also not assuming that we are epidemiological level and to set that expectation on ourselves. So I want to always be realistic with that. One way that I enjoy collecting data in a community is through narrative. So that's meeting with people and hearing their stories. The reality is everybody in this town has a lived experience. They are experts as residents of this community, and that's who I want to hear from. The challenge that we have when we talk about narrative is when we only have one narrative. We have to hear from a lot of different people. So one of the challenges that we did have in our needs assessment outreach is we did reach out far and wide. We did bring in community members to get out and to seek and to reach out. And we have talked to a lot of different groups. But it's not, if we invited one community to the table, we might get 2 or 3 people instead of 10 or 12. That's a different... You might get more information. You might not actually get more information from 12 people because they may not be able to fit their narrative into the conversation. But it's important that that's just not where we stop, right? So when I'm saying I'm talking about a narrative, I'm saying we're talking to a lot of people, and then we pull that all together. And we don't go one and then the other and then the other. So it is still a process of a whole set of data. It's just narrative.
Right, and speaking about narrative, because I remember the previous, I think, study you were carrying out. I was one of the respondents, and the reason I bring it up is because I don't know whether one narrative, for example, my lived experience, would be would kind of give a holistic picture of people like me. Probably not, and I think I mentioned that during the questions asked to say, I have particular biases or experiences that other people may not have. I have some, interaction with the local government. I have this and that in terms of access, related questions. So, just as we plan ahead, what do you plan to have to put in place to address some of those gaps or trying to reach? I know you guys are doing an amazing job trying to reach out, but the response is not that great for some demographics.
And it says a lot, right? It says that, how do you build community? By being present.
Correct.
It's not by asking, can I speak to you? I need to find out your situation. So I think what we learned through this process of our initial, because I'm going to keep doing this. This is a part of the flow of work that a public health director is expected to do. Right? I want to keep refreshing. Everything changes over time. People move on, people move up, kids age out, things like that. So we'll keep refreshing this, but in each iteration, we're going to get closer and closer to the whole community. So this first pass it's eye-opening that there aren't relationships with with multiple sectors of the community enough that the trust is there to have a conversation with us.
Got it.
So we need to stop, take a second. The most beautiful thing that I'm excited about is that my partner in health and wellness for Acton, I'm going to call that, is Wanjiko. She, our diversity, equity, inclusion director, her and I really are working very hard to make sure that we're lock and step as we continue to flow forward in our work. And then the best part about that is we also are working with our peers in our other departments. So they are also recruited. And while we might be leading the conversations, they are also participating. And so whatever we come back with, like what are the gaps, those gaps are going to then start being addressed in these other departments as well. The town needs to have a universal engagement practice. And we're all working towards that. And we have been working towards it, to be clear. But again, we're going to get better.
I like that. Is there anything we haven't mentioned in terms of your vision for this year that you'd like to tell us?
Yeah, I mean, I think I would like to start talking about hard topics, if I'm being honest. We have a lot of, I'm calling them complex housing cases, because typically people will say a hoarding case. Well, there's a lot that goes into a hoarding case. There's a lot of diagnoses that would need to go into someone being a hoarder. And if an individual feels stigmatized by being a hoarder, we don't want that, because that's not going to help them change practice and behavior. Right. So I want to think about that, right? There are a number of issues with people becoming overcluttered, and it's very dangerous for them. And the health department is tasked to make sure that they're safe in their home. But there's another component to here, right? There's another layer, and that's the behavior. That's the need for proper treatment for these types of issues, right? So there's that. Substance use, while the numbers are low, it still needs to be a conversation so that people don't feel isolated when they're experiencing it.
Right.
So I want to start talking about, some of that. I want to think about how we can be more proactive in communicating how you can be well, mentally well, by participating in your community, by doing other things than just focusing on a single treatment modality, right? It's kind of like, I get treatment as an individual, but then I have my family support. What's that look like? And where's my community support? So if we see ourselves as a little bit bigger than just the individual, we can see how recreation and the library and the Council on Aging are really helping to address some of those mental wellness. I mean, I want to keep focusing on the positive for that.
Right.
So I think that's going to be a hard start. I don't know that we'll be rolling out major conversations this year, but I want to start talking internally to folks. I want to start talking to residents about how that could be articulated best out in the community. Every community is going to be very different. There's cultural nuances to this. There's just familial nuances to it, and then really truly, if someone has a problem, what is the navigation to get the help? And that has to be clear before I go telling people this is how you get help, right? I need to know how you get help. So I'm going to be working on that.
Right. And then one of the last questions I have, since you've mentioned it, about, mental health. We are at a time, and, there's no way of sugarcoating this, where people are in a lot of anxiety.
Yes.
Because of the political climate, because of other, different economic climate.
It's a major economic issue.
Right. Both political and economic. So in your line of work, as we're talking about public health, what is in place to support our community that is going through all these experiences right now, and some of them cannot access proper health care to address this? Yeah,
I mean, what I will say is I think that all of the institutions out there are concerned and are thinking and are trying to figure out ways to do that outreach. People are really scared and they're not coming out.
What is Acton doing?
Yeah, so Acton right now, I mean, we can only do as much in terms of healthcare as our healthcare system in this area. And what I am seeing is there is very few practices taking mass health. And until that is addressed, then I don't know that we're going to get out of this issue, right? There's one type of mass health insurance being taken in this area. If you didn't know that and you applied for a different one, you need to go back and get the right one and try and get into that practice. So we have a problem with access to healthcare. If you are not high income, and you are not well established in this community, it is very difficult to access healthcare here, and I'm very concerned about that. But what I'm going to do is use my needs assessment to provide that information to the community and begin a conversation. And so I will continue to be coordinating amongst medical agencies to try and figure out how to address that. But again, the other issue is about insurance and changes to the insurance plans that are coming down, and that's going to also completely disrupt many individuals, even individuals with stable insurance. They're going to see changes that they didn't expect. So I'm very concerned about that. And if I can just keep elaborating, the other concern I have is about vaccines, right? Vaccines have been diminished in the public year over year since COVID. And as a result, we have lower vaccination rates. And what we are seeing is higher and deeper spread for longer of flu. And then COVID is not as much as what I'm seeing in terms of like a spread. And then, it's sort of like, it might be and then it goes quiet. It's not crazy. But the flu, right, went straight up across the state. We are comparable to the state. Nothing happened in Acton that didn't happen across the state. But it's because of the changes in which the way we delivered those vaccines. So for the history of the public health that I knew, we would have vaccine clinics. You'd come down to your town hall or to your wherever, and you would get that. Your doctor would give it to you in the office. Doctors don't have it in the office right now, so you're not getting it in the office. So you are now forced to go through CVS, Walgreens, or whoever the pharmacy is in order to get that. There are multiple steps to do that. Right. There's a lot of gumption on an individual's part to get that done, and a lot of intent. So I would like to make it easier to access vaccines. We've done that. However, people aren't showing up.
Right.
So we are very much thinking about how can we make next fall's vaccine distribution different? I'm not 100% what that looks like yet, but we are going to continue to put our best effort forward and provide those opportunities in real time for our community.
Right. Thanks for the response. But, I guess I just want to get back to the mental health part. You spoke earlier about narratives, the importance of listening to community. And, when we pay attention to what's happening in the community, there is a need for some form of wellness, and I'm hoping that I pray that the town can provide some kind of wellness program for our community, because otherwise people are, experiencing various degrees of mental health, anxiety challenges, and so that's why I brought it up, and I want to humbly request that the town come up, think through.
Can I ask you a question? At what level of care are you thinking about? Because I do want to do this, and I would love to hear your thoughts.
No, just for example, if I don't know, you maybe sharing resources, something as simple as that, because if people are in their homes and anxious and don't even know where to go to ask, and they even fear to ask because they could be targeted for various reasons. I mean, like I said, the causes are different. Some are economic, some are immigration, some are, So if the town could provide some kind of, come up with some program that provides some wellness, if they're not services, resources, that would be great for the people.
And I want to tell everyone in Acton and across the state that the state has walk-in behavioral health clinics that are working well. This is something that they rolled out in 2014, early 2014, 2013. And so it took a while for people to get traction, but if you're having a mental health emergency, you can walk right in that door and get help in that space. Now, they aren't located in Acton, they're located in Lowell and I believe Framingham. I have to double check the second location. But the other thing they have, though, is they have a hotline for the state. And the beauty of the hotline for the state is they do have translation services. So they've really got the backbone of and so what you would call, you can have brief therapy over the call, and then you also can get directed to facilities in the area. Yeah. I've spent a career creating resource guides. So I'm in. I can do it. I would do it. That said, this is a better resource. It's sustainable, it's reliable, and it doesn't require about $5,000 to keep that and maintain that up. Sometimes $10,000 to maintain a database. I know it sounds crazy, but it does, because you got to print it, and there's all kinds of components to it. The state's doing a good job, so I will start promoting that out because I think it's really important. No, I absolutely agree with you. And I want to say, in terms of like financial hardships, it's just so apparent, right? Whether it's a call about something, to the health department, and the root cause is someone's really struggling, or it's something, we see it nonstop. I have the best program that I've seen in my career that we've put out is this housing legal clinics. So it's the second Tuesday of the month, and it is used for individuals with court-based cases, something that could be a court endeavor. And so if you call Laura Ducharme and you're having issues with your housing, she can help you support either that process or another process to try and help move forward. But we've prevented evictions. We've supported people getting other issues sort of resolved as a result of it too that weren't even housing. So it's really working well, and I would be promoting that we continue to do that. And this is a partnership with Metro West Legal Services. I would be remiss if I didn't say that. So.
Well, thank you, Penelope. Again, is one word, last word for our viewers as we close this?
Well, I am just so grateful to be here. My staff they're hardworking and they deeply care. I just so impressive from all the departments that I cover, which is 6 departments. We're here to help. We help with what we got to help with, but we're here to listen and see if you call and I can't help you. You might have helped somebody else because maybe I'm working on building that resource in the future. So it might seem fruitless in the moment, but it might be really helpful long term. I hold on to things that are good ideas. I will come and when the time's right, I'll be like, okay, 7 years ago we said this, we're going to do it, and I don't plan to leave this town. So you will have continuity in this Health and Human Services Department.
Well, thank you again for coming for the show. And to our viewers, I hope you've learned about, the town's prior plans and vision for our town. And I hope you can always reach out to Penelope and the health department at actonma.gov. But for now, thank you for watching. Till next time.